You mentioned surgery. What's your take on preventative surgery? We see stories of people like Angelina Jolie that has both of her breasts removed in case she might sometime down the road get cancer.
Well, that refers to the BRCA gene scare. You know, it really was quite a Hollywood hype, you know, last year. And I'm not judging her. I mean, she saw her mother die a very horrible death. But there was a lot of misinformation. The BRCA genes are actually cancer protective genes. They help to repair DNA damage. And so the BRCA gene, if it mutates, then it can cause a problem possibly, but what causes it to mutate? You know, look at the foods, look at the radiation. So BRCA genes are tumor suppressor protective genes.
So do you inherit breast cancer? Or breast cancer genes that are, is it inherited? Is it genetic?
You know, that's the big thing. Well, you know, my mother had breast cancer, so I'm probably going to have breast cancer. But we now know through the study of epigenetics, which is the science of looking at gene expression, and nutrigenomics, which is the study of food, we know that we can change our gene expression by what we eat, how we sleep or don't sleep, how we manage or don't manage our stress, you know, the foods that we eat. So something as simple as curcumin can help to really turn on the cancer protective genes and change those gene expressions.
I interviewed Dr. Sunil Pai again,
Yes.
and he mentioned that specifically, that curcumin has an epigenetic effect. It can switch on or switch off the things that need to be switched on or off to keep you healthy.
And that's just one of the foods. I mean, things like broccoli sprouts and ginger and boswellia, you know, all those things are anti-inflammatory and turn on those protective genes.
What about treating breast cancer, or any kind of cancer for that matter, with toxic drugs?
Well, let's talk about aromatase inhibitors, or drugs like tamoxifen. So tamoxifen is a drug that most women are put on when they have breast cancer, but they don't tell them that it's classified as a carcinogen by the American Cancer Society and the World Health Organization. So does it make sense to give women a carcinogenic drug that will cause cancers in other parts of her body to prevent cancer? So again, it goes back to, you know, what can we do to support the body and support the immune system? And things like fermented soy and ground flaxseed can have a very similar effect to drugs like tamoxifen.
Is there a connection? You mentioned some good foods. Is there a connection between the foods you eat and breast cancer?
Well, absolutely. You know, you go to a chemotherapy suite or you go to a hospital and, you know, what do you see? Sugar everywhere. And if there's one food that women need to avoid if they're on a breast cancer healing journey, is sugar, because we know that sugar feeds cancer. Cancer cells have more insulin receptor sites than a healthy cell. So the first cells that get fed the sugar is the cancer cells.
Right.
So, you know, any type of, like the GMO foods, the sugars, anything that's packaged, can certainly lower the immune system and increase the risk for cancer.
Hi, this is Ty Bollinger. Thanks for watching. If you want to know the truth about cancer, click the link in the description below to watch our award-winning docuseries, The Truth About Cancer, A Global Quest.